It came actually from a number of different things. Just being the kind of person I am early on in dentistry, I just started to develop a system or a procedure for about everything having to do with treating patients, but also in running a business. And at that point, I had one office, and decided those systems could just as well support two. And there were two other things going on at that time. This was 35 years ago. You know, one of which is the physicians were forming together in groups, and that was all about just sharing the overhead so that you could pass those savings on to the patient. And thirdly, it was kind of insurance driven. The insurance companies 30 years ago were making a big effort to drive down the cost of dental care by limiting how much they would pay for certain procedures. So I can honestly say I kind of saw that future in the costs going up, so we tried to counter driving the costs down with what we expected to be paid, which was less for procedures. And, you know, 10 or 15 years ago, the maximum dental insurance payment, for example, on Blue Cross or Blue Shield or whatever, would be $1,500 a year. You know, it's still $1,500 a year.
Yes, I was going to say $1,500.
I said 10 years ago. I remember 20 and 25 years ago it being $1,500 a month. So there had to be some kind of a business mechanism to offset that. And there's another plethora of reasons why the group practice of dentistry, like we do it typically, we'll have 2 or 3 doctors in an office. It's just way better. It's just way better. Just sharing ideas, getting other doctors' opinions on cases, and just the investment in technology and procedures and continuing education for the doctors. It's just a whole new world.
And when you have new dentists come in, they don't just fly on their own and experiment on patients hoping to figure out how to do it.
Oh, absolutely not. No, we'll team them up with a more tenured doctor, someone that's been in practice for 15 or 20 years, and we've got training programs for the doctors to go through. Our doctors are, the future of dentistry, for example, Jay, it's, for example, implants is huge. That's huge. But implants takes a lot of training. You know, you should be working with some other experienced practitioner to learn, when you do your first case, for example. And there's just a lot of benefit to being in it's a lot of benefit for the dentist to work in a group like ours, but the big benefit is for the patient. The patient is just way better taken care of.
Quality of care goes up, cost goes down.
Yep.
And also you look